button. Perfect. So welcome to this Experio Reflections. The Experio Reflection is an event that we have when we at Experio Lab are writing about twice a year. We have already been releasing one of our reflections before. I think that was about 6 months ago. And now we have our new Experio Reflection number 2 that we will present in this meeting today. And the idea of this presentations is not just that you should listen to what we have been thinking about or what we have been writing, but we want to have some kind of discussion together with you, some kind of reflection back from you as well. That is why we have sent out this reflection piece beforehand. So if you had the time, you probably have read it. So you might have been thinking about things in it. So the idea about this session is that we will, even though maybe all of you haven't had the time to read it yet, so we will have a presentation of this reflection piece by Kajsa and Matilda from Experio Lab. Will take about, I don't know, 30, 40 minutes, something like that. And then we have our dear friend Nicola Morelli, professor in design, that will be our critical friend for this reflection piece. So after the presentation for Kajsa and Matilda, Nicola will come in and do his kind of reflection of the reflection, so to say. And after that, we have a common reflection together with you, with questions and reflections, and hopefully some kind of discussion together. So please feel free after this kind of presentation and the reflection to jump into the discussion so we can have a broader widening of this kind of reflection piece that we've been writing. So that is the idea about this session. And with that kind of presentation, I will let Kajsa and Matilda in, and please.
Yeah, I'm going to start and talk a little bit about the piece that we're presenting today. And me and Matilda are going to go a bit back and forth between us. So the kind of backdrop of the piece we've written today, it's about the public systems that most of us are working in, are increasingly facing more complex challenges, from the sort of demands and increased pressures on the healthcare system to climate transition to the need to integrate services more. And this requires new approaches. And design has come to play an increasingly important role in this context. And by using co-design, where we co-create policies for those affected, design can contribute. We can use empathy, inclusion, future scenarios, and design can offer a complementary approach when we're developing new policies in our public systems. And it's against this backdrop that our practices in Experio Lab and our sister organization called Samhällsnytta at the University of Karlstad, that we have evolved our design for policy practice. And one part of that evolution is that we have experimented with transdisciplinary teams that combine design expertise with the knowledge of the relevant systems and subject domains. And we can have transdisciplinary teams where we combine design expertise with knowledge of the relevant systems and subject domains, often political science or law. So that's kind of the topic of this piece we've written about, and about this talk today, about the synthesis between political science and design, and what that means for policy formulation and what it means for design for policy as a practice. And if you've read the text, you've seen that we use a metaphor of whisking or creating mayonnaise, and that we think that our work does not consist of just adding design to political science, that 1 + 1 is 2. Rather, it's about a shared practice and where the two domains together create something new. So what we seek is an emulsion, not between eggs and oil, but between design and political science. So that's kind of the idea of this piece we've written. And we argue in this piece through a case study, which was a collaboration between us in Experio Lab and Samhällsnytta and a government committee called Vårdansvarskommittén, which in English translates to the Healthcare Responsibility Committee, quite like literally. And to give you some background, in Sweden, the the Swedish government can appoint a committee when they want to investigate and propose new legislation or new big reforms. So these committees are given a directive from the government and issue a question, something to investigate, and then they independently investigate that. And at the end of their term, they hand over a report with proposals to the government, and then it's up to the government to decide whether they want to proceed and have a proposition through a bill through Parliament. And the task for this specific committee that we're going to talk about today is that they were to investigate the consequences and possibilities of handing over responsibility for both financing, organizing, and providing healthcare from the regional level, who has this responsibility now in Sweden, to national government, a sort of centralization of healthcare. So today we have 21 regions who have their own political assembly who are responsible for the provision of healthcare in Sweden, and which this proposal, it would have been transferred to the national government. And this would have been like a major structural change in Sweden and a very big reform. So that's why this committee were appointed to sort of investigate this beforehand. So they had to find out if there really were any arguments for such a reform. Would it lead to increased accessibility, that we would have shorter queues, for example, to healthcare services? Would it guarantee a more equitable access of care geographically? Because that's a problem in Sweden, that if you live in a big city, you access care of high quality, for example. And could it also lead to a more cost-effective system, which is something that's greatly needed in light of these increasing financial pressures and demographic changes going on, which is the same for lots of Western countries. And to understand these potential consequences, the secretariat of the committee, they realized that there was quite limited scientific evidence that could guide them, because this is such a complex structural change that would take place over many years. There's so many dependent factors that can make a difference. And it's also very difficult to compare reforms within different countries because of these different contexts. So instead, they asked us to help them to co-create new knowledge. Could we use experts and different system actors and patients and families to together co-create new knowledge about what we thought was going to happen if this reform would be carried through? They, of course, also did a lot of other traditional sort of analytic and investigational work. So this was just our work, which is a part of their committee work. So we wanted to understand more about the potential effects of decentralizing of the healthcare system, and we wanted to add different perspectives in this sort of journey of understanding. We wanted to understand the patient perspective, family members, healthcare staff, representatives from regions and municipalities. What would they think about this kind of change? The government agencies, experts, and so on. So our task was that, together with the secretariat of the committee, to use system design and produce a co-creative process with all these systems actors to see if we could find this new knowledge, these new insights of possible consequences of this reform, both positive and negative. And this was especially done in relationship to certain aims that were pointed out in the directive to this committee, which was accessibility, equity, and efficiency were the main ones that we looked at. And Matilda is now going to tell you a little bit about how we did, what was the methods and methodology together with the committee.
There now, yes, I will. So this is the process that we created together with the secretariat. And since we're working with the co-creative service design and system design, we did not treat this potential reform as an abstract policy problem. And I think that's what we're talking about. So we planned and facilitated the process with representatives across the system, like Kajsa said. And we wanted to build this shared understanding through this process, to understand if such a reform could contribute to more geographically and equitably access to care and enhance efficiency in the system. And in this three-loop process that we also planned together with the secretariat, which is one of the things that we felt was the most beneficial in this process. we conducted the first loop, which was kind of a classic system design workshop on nationalized healthcare, where we tried to make visible all different perspectives through this puzzle, which we're going to go into deeper soon. And then we had a second loop where we examined how a full or partial nationalized healthcare the impact drivers for equitability and efficiency in healthcare could work. So here we had lots of experts. And then in loop 3, we got to also help the Secretariat themselves internally and work on analysis, which we also felt were really, really nice and also benefited our, like we talk about today, our mix of the competences in this planning. As Kajsa said, that we were both designers, but also people who knew the laws. So in the first loop then, we conducted this workshop with participants with all these different perspectives, from patients, representatives to also experts. And when you do this, you need to have something on the table usually to also make that possible. So we used this and their experiences for the basis for the scenario building about what a state-governed healthcare system could look like. So the work took its part of the pointer in concrete values that should be realized through these reformed systems as an inspiration. And it was supposed to improve access, equity, or system efficiency. And this we felt was a really crucial point of building this puzzle, that we also had some sort of point of departure that these puzzles could be built around. And the participants were asked then to create scenarios of this state-governed system with these values, with this large kind of quite simple, but still a jigsaw puzzle where the pieces represented components of the actors in a future system. So they built it with, for example, there you can see IT and the central authority. And we also had name-given authorities around this puzzle. But then we also added the patients, of course, here. And also we had quite a lot of empty pieces as well that the participants can fill in themselves also, which kind of organization or authority or patients' representatives should be in the system and where in the system should this be. So this was an organization of a future central authority. And to create this quite far-reaching reform and a quite complex system, we made several methodological choices. And one was also to create this arena where perspective can meet and collide with a structured safe space, where the people in the room became aware of others' viewpoints and perspectives, as well as their own. And this was said fostered a richer understanding of how the system works and enable the participant to co-create knowledge in this reform. And also what we brought with us a bit more design theoretically wise. We know that we have to, or one way is to externalize mental models. And this puzzle made it possible to make the participants' implicit assumption explicit and make them visible for others while they were at the same time constructing the system. And this is a core way a simple representation like a puzzle can help participants to be able to make their own thoughts visible, and also then crucially engage with other thoughts and make together. But there are also several comments about that this felt like a concrete handling of complexity, where this quite abstract notion of a healthcare system became a tangible artifact that we actually could reshape and debate in these sessions. And the participant could actually see and move and reconfigure the system before their eyes. And everybody around this table can do that. So in this way, the abstract system was also populated with participants' knowledge and experiences in the far-off future. But it was also said that one of the advantages was that this populated the system. So this method also helped people imagine the humans who were actually constituting the system, who were in these different authorities, and what were their relations to other in this authority or in this system of healthcare. Who were they acting together with in the gaps of these two different puzzle pieces? So when the puzzle was assembled, the relationships became visible and also enabled reflection on how those relationships would need to function to advance these chosen values then for each built system. And we also felt, and the secretary also said that this was lowering participation barrier and building trust. So this visual and tactile approach created a more open dialogue, which formal status and rhetorical skill matter less than the shared will to build understanding when we build this system together. So beside these more methodological factors, there was also this other thing that mattered that we're trying to capture in this paper. And the Secretariat observed that our transdisciplinary competence is, when facilitating the group, also fostered trust and openness in general. So the many participants held very senior roles and arrived with different expectations and assumptions. And many of them were also skeptical of this question at hand of the centralization of the healthcare system. But when we demonstrated deep knowledge of the healthcare system and its actors, it was easier for the participant also to trust the process and contribute actively in this process. Yeah, so back to you, Kajsa.
Yeah, so Matilda's now told you a little bit about what we did and about how we combined the knowledge of visualization and scenario building of designers with the political science knowledge and the kind of deep knowledge of the healthcare system that the members of the teams had. And to continue a little bit about this metaphor, we feel that you need to sort of understand the different components of the mayonnaise. What is the political science part and what is the design part? And in this metaphor, we think that political science is like the egg, is the stabilizing, the structure giving component of the mayonnaise. And its theoretical foundations rest a lot on democratic theory, institutional theory, governance research. And focus of it is very much how do political aims translate into effective and legitimate instruments, into institutions, into organizational solutions. So that's sort of what we're investigating in political science. And the core questions often concern which tools can support this kind of democratic steering and accountability. And implementation is seen as a complex process in which the administration act as an active interpreter and co-producer of policy. So we sort of are kind of reasoning that political science, we think, in these kind of collaboration projects with policymakers, provide an essential understanding of the logic, of the constraints, and the formal requirement of this sort of political administrative system. So if you don't understand this base and this logic, policy development risks becoming ineffective. Maybe you'll come up with lots of nice ideas, but they're not really set in the context of the sort of power structures and the logics and the sort of practices of policy making. So there's a risk that they can become decoupled from the knowledge of the practices that in effect really governs the system. So that's one part of the metaphor is the political science. And now Matilda's going to say something about design as being the other part of the mayonnaise and the metaphor.
Yes. So if you were the stable egg in this thingy, the design represents the oil. We've said the fluid in this and is the form-giving ingredient in this mayonnaise. And design practice is grounded in intentional form-giving, and to do that, it requires a surfacing of plurality of perspective through participation and the attention to power relations and norms, and also to listen to those whose voices and perspectives that might need strengthening. So that might not be the oil, but the oil we feel is the creative methods that can build understanding of complex challenges and open possibilities of new ways of seeing, since the oil is also transforming the egg into another thing, into another materia. So the goal we have is to shape policy that is genuinely understandable, usable, and meaningful for the citizens, patients, and those who will use it. And the focus we have is consistently on lived experiences and the needs of the system. And the methodological stance is generative, explorative, and co-creative, and using tools such as prototyping, visualization, and future scenario work. And of course, we often do this in workshop where we gather different perspectives. And the design methodology brings a distinct capacity to work with uncertainty and to render abstract systems concrete and to create shared platform for dialogue to bridge professional and hierarchical boundaries. And the crucial thing in this we've seen is colleagues or our colleagues with political science competences through their deep grasp of the system logic and political institutions relevance. They can act like a bridge to in this case, then the secretariat and the workshop participants and establish credibility and trust. So to sum this up, the transdisciplinary teams that cultivate trust in the design process through tacit knowledge and experience, and we're enabling understanding of relationships, positions, and nuances within the system, and can potentially expand the boundaries of what design can contribute with to policy formulations. So our questions or our thought that we are sort of dealing with is if these transdisciplinary teams is a path to more realistic and pluralistic policy practice.
And we can say there's a risk maybe otherwise that design becomes more of a tool in a kind of quite technocratic practice, grounded in more like a single worldview. But we're hoping with this transdisciplinary team, where we feel that as Matilda said, the sort of silent or tacit knowledge of the people who knows the system, understands the relationships and the positions and the sort of underlying components of the system, that can contribute to more trust with the different actors who are in the policy creating process, and maybe then design can take a stronger role and be more. It can ask other questions. It can kind of allow these sort of clashing perspectives. And we're gonna in Samhällsnytt and Experio Lab, we're gonna continue to work with these transdisciplinary teams and see how we can use that to address these more complex societal challenges that we work with in our organizations, and where we think that the interplay between design and political science can work as a catalyst for more learning-oriented, inclusive, and meaningful policy processes. I think that was the end of our little run through of the text.
Perfect, thank you. Before we let Nicola in, I think we have at least two kind of questions or reflections in the chat that might be good to have before we let Nicola in for his kind of reflection. And I think the first one is maybe I'll take the second question first, I think, from Sebastian. Then I go to the one from David. Because Sebastian writes, you could ask it yourself if you want to, Sebastian, but I can just try to summarize it. That's there are a few terms and design prefixes that we use interchangeably, both in the report and also when you do the presentation now. Could be co-design, could be service design, could be systems design and systemic design. And from Sebastian says that in his mind, it's a bit different in approach and methodology for those practices. So could you please clarify how you use the different types of design approaches in the projects and how they conceal to the differences stages of the part of the process? So could Matilda or Kajsa maybe say something about that?
Yeah, I can start and try, but that is a difficult question, and I think especially when we work in this quite not transdisciplinary, but quite many disciplines as well in society, where we also use design, or people have a different understanding of what design is, and the people we talk to. So I think this is a constant question for us as well. What terms should we use and why? But then I also totally agree on that there are different approaches to code design, service design, and system design. And I would say that we are sort of, or Experio Lab has a base in service design, where it's super the person-centric design, where you look at that type of need. So that is what we keep, but also we have a quite clear systemic, or the systems design, but systemic design, I would say, is the relations between the actors in the system, where we are sort of leaning towards using Avink, for example, as a researcher in that. So then that is more of the relational part of the design. But then I think we're a bit sloppy maybe and talking about systems design, but that could also be about the more of the organizational part of it and the more hard parts of the area that we're working with. So yes, but we should be more precise, especially maybe in these papers. But I think it's a problem, but also yes, I'll take that further.
Great, thank you. We can maybe come back to that later in the discussion, but we would let also David in with this question here, and I think that is more focused on those workshops that you were doing with the puzzles. And the question is, did you arrive at different scenarios or artifacts which differ significantly, and was there a lot of variation? I think, do you mean, David, if it differed from the normal way of rigging an organization?
I could try to answer that. So I think there were 6 groups in that workshop, and they were giving 6 different values to work towards. So there was one group working with innovation, one working with efficiency, one with equity, and one with accessibility. So obviously that influenced and made influenced them, and then that sort of translated into slightly different scenarios or sort of jigsaw puzzles. I do think, if I remember, this was a while back, but I remember that there were variations, but there were also like core components that were quite similar that we used in our analysis. What we did after that workshop was that we sat down and looked at these puzzles and looked at all the notes from each group, and then did quite an in-depth analysis that we presented for the secretariat. And that's also an area where we combine sort of, the analytic force of sort of design with the knowledge of the political science, or the people knowing the healthcare system, because I think that kind of analysis would have been quite difficult, or it became more nuanced and maybe more in depth because we had people with knowledge of the system doing the analysis. So there was definitely some variation, but also it was sort of set up to vary because they have different values that they were building the system around. But in terms of artifacts, they had these sort of jigsaw puzzle bits. They didn't have any other artifacts. Is that if that's what you meant?
Great, perfect, thank you. Well, then I think we go to our critical friend, Nicola Morelli, and invite him into this conversation. And maybe, Nicola, you would like to maybe do a short presentation of yourself before you start your kind of reflecting piece.
Yes.
Welcome.
Yes, thank you for inviting me, first of all. I work, first of all, I'm an Italian migrated in Denmark and work at Aalborg University in Copenhagen, where we found a research unit called Service Design Lab, which is working on the teaching front. We have a master in service systems design, and the research front that is participation to a number of research projects that are where we put service. I mean, we define service design as a pluggable discipline. So we have we can, with our competence on service design, we often enter into projects that are of different kinds and different nature. We started with a project on elderly people, then we had a project on data, open data and how people use open data, project on migrants, project on how cities are changing or could change, projects on how art could be integrated into urban change. So many different areas. And probably I mean, my observations are very strongly influenced by a seminar that I recently, yesterday, I had with one of those projects, European projects we are running that is called Climaboro, in which we are using a design approach to change urban to shape urban policies towards transitions. So somehow I tend to mix. My brain is not cannot separate the two things. So some of the observation come also from what I learned in those 3 days. And coming to the presentation, it was extremely interesting. Um, I from Kai and Matilda, Kaisa and Matilda. Um, I have three observations. One concerns this metaphor, which is very suggestive and very interesting, because okay, if we take the mayonnaise, we have the oil and the egg, but if we mix the oil and the egg, we have something that is neither oil nor egg, but is something in the middle. And one of the first things that this inspired me when you proposed to participate to this seminar, and when I read the document, was the fact that if we continue the metaphor, probably we should also think that if we have design and policy making and we mix it, what we have is something in the middle that is neither purely design nor purely policy making. What does it mean? Well, first of all, well, we are. I'm not sure. I know. I'm not even sure whether I'm right or not. First of all, but if I'm right, so what is this mix that is in the middle? What is this mix that it is has something about design but is not design, has something about policy making but is not policy making? Um, uh, First of all, something that is not policy making, but it is design informed and it is very close to policy making is, I mean, the example is Experio Lab, for instance. So something that, or for instance, the policy labs that we see in cities. So something that it's not yet policy making, it's not yet political science. It's not political science, it's not yet policy making, but it's something that is a sort of structured organization that approaches the topic of policy making with a specific approach that is a design approach. So probably this mayonnaise is already existing, and it is an Experio Lab. It's incredible. It's very very nice that this comes from. This metaphor comes from Experio Lab that probably is discovering now to be a mayonnaise. But it is quite interesting. I mean, we need centers like this. I've seen it in countries where this experience doesn't exist, and the distance between policymakers and designers is very is very big. I mean, as I said at the beginning, I'm Italian, and in Italy, this kind of thing doesn't happen. There is no national policy lab. Sometimes there is some policy lab at the urban level, and I can see that the distance when the policymakers do not understand designers, they do not understand how designers. The designers' proposals are usually very far from their way of doing, from their practice. But when we talk about the difference, I mean, when we say, okay, it's something that is not policy making, but it's not also is not design. And so I come to my third point and to the question that has been asked before, the question of finding a clear definition of uh, clear methodological definition of what is design, service design, system design, or co-design. Well, here I would like to launch a provocation that is an anti-methodological provocation. So when we work with policymaking, when we work on practice, do we really need to keep this methodological difference between co-design, system design, service design? Do we need to specify, this belongs to this, to service design, this belongs to service design, to system design? Or it is more important to understand to what extent um, we need those experience, this practice, this so not practice, but this methodology that comes from service design, and to what extent can we mix it with something else? I think what counts at the end is the practice of designing with policymakers. That is a new practice that we as designers are learning now. Some of us is probably more. I've seen that in the public there is Lise Malmborg, which is sorry, Luna. I don't remember the name. Sorry, but I read her work, and it is very interesting. And I think there are people here also in this audience that are very experienced in working with public administration. I'm trying to get some experience in working with that, but I think I think it's quite clear that we cannot approach policymakers with the the way of thinking that and the way of talking that we have when we talk with our design colleagues. We need to find this common practice, this shared practice. Uh, and so this was my second point. And then I have a third point that is that comes from what I learned yesterday, as I mentioned before. How is designing interacting with policymaking in terms of understanding, addressing, mapping, and trying to solve problems or address opportunities. I found that there are, from my experience, the project I was attending yesterday is a project with 12 cities. And for each of those cities, we are proposing we are sponsoring some financing some service provider that solve a specific problem of the city related to either energy or heat waves or circular economy and so on. And for all those cities, I've seen a sort of patterns that in some cases more recognizable, in some cases is less recognizable. And for instance, but maybe one city is quite interesting, the city of Grenoble, that has a problem of heat waves. So design can help the city at three levels. First level is realizing where the problem is. What is the problem? Because, for instance, heat waves, Grenoble is a city close to the Alps. They've never had problems of heat waves, but now with the climate change, they are having a problem of heat waves. So design can help through by having scenarios, workshop, working with people, asking people, involving people with a participatory approach. They can actually realize that there is a problem. The second level is mapping this problem. So it's framing it, trying to understand who is actually involved in the problem, where is the problem evident, in which situation, what are the consequence of this problem. I'm talking about problem, but there could be also opportunities. Like another city was working with the energy communities, another opportunity. So, but mapping it, trying to understand who is involved. And the third level, there is addressing the problem. In the presentation I heard from Matilda and Kasia, the first two levels were quite evident. So talking with people, having their own picture of how certain phenomena are perceived or certain problems are perceived, trying to map those phenomena, understanding also who are the other actors involved. And the third one, the third level, so addressing the problem, is something that was already there, but it was less clear. That, for instance, when we were talking about scenario building and so on, so I'm trying to understand what are we doing to address this problem. And I've seen, for instance, in some cases, people are building prototypes and verifying prototypes, verifying scenarios and so on. So those three levels are probably something. I mean, now it is something that I've been trying to work on in the last few days. So I'm not sure that it is a valid kind of classification, but it is something that your presentation, together with what my experience in the last few days, seems to it's something that is interesting, in my opinion, to explore, uh, both in your work, but also in the work in the work of collaboration between design and policy making.
Thank you, Nicola. Thank you very much.
Sorry for Lise Malmberg, and sorry for no, since my colleague, I have a colleague working with that is Lone Malmberg, and so I make a bit of confusion with the names. I'm very sorry.
And Lisa Momber is in the meeting as well. So yeah, that was the presentation. That was the reflection from our critical friend. Before I let you from the turn in, maybe I just turn to Kaisa and Matilda. Is there something you want to pick up on from the things that Nicola were telling, or?
No, I think that that Nicola talked about the distance between policymaking and design. I think that's sort of what we're trying to write about, how this transdisciplinary team can work as a translator almost. So in this instance, Matilda was the designer in this healthcare project, and I was the sort of person with a political science or system background. And we also had a colleague who has been a sort of manager in the healthcare system for a long time and who has a background in law. And I think it becomes an issue of translation almost, because me and my colleague, we know something about the design methods, so we can sort of understand how we need to translate that into the language of the civil servants in the secretariat. And when they understand a bit more, and they're kind of, we can also understand, the restrictions and the demands they have from the government, then that creates sort of like a space where they are more, where I feel that they are more kind of secure and creative to actually participate. So both the secretariat and Anders, my colleague with a long background in law and kind of management, became very creative with the design methods, because they started using design in their own ways, because there was this sort of translation going on in between. I don't know if you want to add something, Matilda. So I think the distance, we're trying to work on bridging that distance between policymaking and design in different ways.
Yeah, agreed. And I think that is one of the crucial thing to be a translator, or like to be able to use this design methods within this area where there are a lot of experts in their area and a lot of talented people that we meet in this, like the secretariat, super impressive people with high education. So it's but it was really fun also to see, because I think you talked the most probably in our common meetings, Kaisa, but then you sort of get into it a bit more, and you can also start talking about what you do. And also in relation with the questions and what words of design we use, I don't ever think we almost talked about design with this group that we met even. I mean, we do, in this areas, we also do what we do. So we also we are sort of suggesting methods that sounds reasonable with specific questions. And why we do that is because we have a background in design and know what we're after, sort of. But it doesn't help to talk about design. It's a practice. But I also think that what Nicola said about framing the problem and mapping the problem and then addressing the problem, I think we also we would like to develop, as I think you mentioned, Kaisa, and maybe I did too, but also the implementation of policy. I think we almost never get to that stage. I don't know if that's what you mean with addressing the problem, but we get to the stage that we can frame the problem and map the problem as we did in this space very much, but also created scenarios with quite simple visual tools. But that it was very effective also to make it visible, sort of this quite complex system. But if I interpret you right, Nicola, but to addressing the problem and working with the problem, I think we would want to do that more, but that would require even more, I think, engagement and also to dare to test these policies. I think we've been after to do that. We wanted to do that a bit with this project as well, but we didn't have time. So I think that would be sort of the next step, to try to roll out the policy with a design method, like in a role play we talked about, or to make it more tangible, visible in a small workshop space, but preferably to also test it in reality in some way. That would be really interesting to do to move this forward.
If I can add a little bit from what I've seen, probably the first step, I've assisted only to the first step of addressing the problem. That is, very often the contact between design and policymakers happens through a sort of bridging person. So only one person or a small group of people, 2 or 3 people working with designers on a project. I don't know if it is the same experience you had. And the first step is to extend the participation from those 2 or 3 people to the organization in public administration, making sure that identifying the departments that would be touched by any possible change, and trying to make sure that those people become part of the change. Because when you start, for instance, when you start experimenting, like we use a term called sandbox, the place for the experiment. When you start experimenting, it is very important that also those people are participating, because they are problem owners. So they know how to articulate the problem much better than the contact people. And also because they are solution owners. So they say, okay, for this problem, we usually have this practice here, and this practice can work, or this practice doesn't work in this condition. So it's very important to like, extend or trying to, and it is somehow the ability, it depends very much on the ability of the contact people to see how good bridge they are between the designer and the organization they are working with.
I also think it's interesting how, because really what we did in this collaboration with this committee is that we were generating new knowledge, and how design was a catalyst for creating knowledge, maybe rather than creating kind of concrete change, since this was still a committee that were just investigating things. That, it was the next step is then implementation, if the government would have sort of liked these proposals. Sort of government. So I think they said these values we worked with in these workshops, the Secretariat said that when they were writing up the reports, they felt they had so much more in-depth and nuanced knowledge around those values we worked with, rather than another set of values that have not been in these workshops at all. So I think it's interesting, how can design contribute when we have, this messy world? There's lots of dependent and independent factors, lots of things going on at the same time, but design can actually contribute to gathering people and sort of see what is the collective knowledge that we're gathering from people who knows a lot about these subjects, but from different perspectives. So how can we use design as a sort of knowledge generative tools?
Yes.
Perfect. Thank you very much. I think we'll open up the conversation now. I see things are happening in the chat, and maybe we should move the discussion from the chat into this Zoom room somehow. And I think that's while you are looking for the raising hand button, then I might let Jan Sturestig in, because I've seen that you've been writing some things in the chat here, and I know that you have an interesting perspective on this field of what should we call it? Should we call it design, or should we call it something else? Or should we don't even talk about design? So maybe you could just have your say, Jan, about what you've been writing, and then I hope that the other people in the room will keep on that one. And raise your hand if you want to have some kind of reflection, and please do, because we want to have this as an open conversation as possible. So please, Jan.
Thanks. So I'm mainly jumping on the wagon that was already rolling about design, the word design, whether it's working as a beneficial thing when you in these workshops, like you had in this project. For instance, that's the first question, and for everybody here, of course, if it's what you can use instead. Not even going into different kinds or aspects of design then, like you were talking about, Nicola. And the other thing that I was just realizing here is that there's so many benefits just from the common ground and the bonds that are created in this project that you did make. I also realized that from earlier experience that you manage all those things, but then this project ends, and what happens with all this? There's some kind of level up that has happened between those people that you that tend to be, I don't know really. Often I just leave the project, and I don't know if they keep having contact with each other and using it in a way. That situation. What's going to happen in this project that you were working in, and what do you all think about how to making those networks live on a bit further, if this is actually one of the main things that you create, except for the outcome in the report? So I don't know. 2 questions.
I can say something, that when we're working with these government committees, because we worked with 7 of them, that's a big problem, because they have, they just last for a year and a half, and then that committee is dissolved. So we never get the chance to sort of level up or use those relationships. But now we just been given a grant for a bigger 10 million project, or like 20 million project, with also funding coming from the organizations called Omtänkt. And then we're going to work over 3 years with 3 regions and 25 municipalities. And in that kind of a long-term, we call them arena building. We sort of set up an arena where different actors can come in and work together. And there we're putting a lot of emphasis on the relationships, which we think has been one of the most important components. So then compared to the committees, we think at least now we have an opportunity to use these sort of, building knowledge and relationships together, and then sort of leveling that up, hopefully also leading to sort of change at the end. I don't know anyone of my colleagues wants to comment on that as well, but I know that's one of the kind of frustrations we have with this committee work, that it is quite, it's quite short and it's quite limited, and it's their kind of framework that decides what we can do and not do.
But there has been sort of leveling up from this as well, because right now we're talking to one of these people that we worked with in this committee about doing another thing where he is currently employed now, and another person that we worked with before is now joining us partly as an expert. So it has kind of other what do you say? It has other leveling up practices,
effects,
effects is sort of trickling. This, ripple effect of other stuff happening, even though that specific committee is sort of dissolved. And also your first question about if we use design, I think we more and more, I don't know, I think it was a valid comment about keeping them separate, these different kind of practices in terms of like learning and putting back into the design research community rather. But I would say when we introduce projects together with people, and especially like these kind of projects, I think we would rather talk about what we do and plan both the process together with them and the events together with them, and do not talk about what type of methodology we use. But that is a what do you say? That has been a long learning curve. But I think that is how we tackle it, or how we do it currently. And also design and service design has gotten so much. I think it's good. It's around in the municipalities and regions a lot, and they're employing service designers, so that's super. But I think also, since it's also going around, people have their own interpretations of what that is currently. So yeah, it's difficult. It's difficult, but I think right now we're handling it by talking about what we do rather than the sort of theory around it, I would say. I don't know if anybody disagree.
Thank you. I see that there are not that many hands in the Zoom room, but I see that there are really interesting things in the chat happening, and I want to have you, David, to ask to have your reflection from the chat, maybe out loud. Is it possible? Because I think that is something really interesting in that one, and I will also let you, Lisa, in a bit later.
Sure. I guess for me, this is in contrast to I also sit in a local council here in the city, and it feels like in a way the I guess the conditions for a mayonnaise together are much more limited. So I wonder, like, is a possibility for kind of like micro interactions or micro interventions for like reframing priorities in local councils, or kind of like looking at these small kind of opportunities to reframe problems. For example, I mean, now we're looking at school questions and like education, and we also have a budget priority. And it feels like even if we have kind of different, policy interests, we have also a conflict of values, and kind of these small ways to trigger reflection in local council feels like it can kind of like big shifts in consequences for local policy. So it just strikes me that there's quite different, I think, preconditions for mixing mayonnaise at different levels. Maybe we need different types of mayonnaise.
Mm-hmm.
Yes. Agreed. Nice.
And this was also a project where it was very, very it was very clear that we were working with policy since it was on the national level, whilst maybe the kind of work you do, David, the policy is a bit more hidden in a sense.
But isn't it also, just a reflection from me here before I let Anton in there, but from what David is saying, and also where I think a couple of other questions in the chat, and also what you said, Nicola, about this framing the problem, because when we do these commissions, then the problem is most of the times already framed from the beginning when we got to start working with. So maybe our definition, what is the problem, might not really resonate that well, sometimes at least, with what the problem that the commission has been given to work on. Could you maybe say something about that, Matilda or Kaisa, or am I right? Maybe I'm wrong. I mean, comparing to doing a more work more on a local or regional level, then there might not be that defined problems from some kind of politicians or from some kind of high management.
So the people who work in these kind of secretariats, their main task is to address the questions in this directive given by the government, and they're not usually very keen to sort of keep within the framework of that directive, which means that that's obviously a political sort of angle taken on this problem. What do we leave out? What do we include in these questions and that kind of thing? And these civil servants are usually very loyal to the directives, which means that there's already the boundaries for what you can do has already been set up. And I guess what we're trying to do is we're trying to help them illuminate those questions from more perspectives than they usually do, from the user perspective, from the sort of frontline staff perspective. And I think we've had collaboration with committees where we kind of have tried to provoke them to go a bit further out of the boundaries, but usually that's not very easy. We usually fail when we try to do that. So it's a very bounded kind of work that we do. But I guess for us, it's also interesting, maybe the main point is not the results that we contribute to in one sense. I think it's for us also that we have been able to develop these methods have been very important for us. And then we probably contribute to results in some way, we hope. We're one of the first committees we worked with. Those proposals have now become bills. They're going to go through Parliament. But it's a long, it takes a couple of years before that happens. So it's a very long process before we can see kinds of actual results for citizens. Now, Matilda, if you want to add something.
No, just reframing a problem. I think you do that kind of when you work with the participatory methods often. So I guess it's just a matter of how open your sort of who you're working with are. But I think that is a common.
And I think
that is one thing that you do.
Sorry. Yeah, I think also we should remind that we don't have a best practice here. We just have our way of doing it, and I think that you have a lot of better practices out there that you can share with us as well. So don't think that we sit on some kind of answers, what is right and what is wrong. We just trying to do this just as much as I think you all do here. But now we have at least 2 raised hands. So please, I'll let Anton into the conversation. Please, Anton. Maybe you will do some kind of presentation as well.
I can say hello and thank you for a great presentation of your work. I'm currently working in the private sector, but see similarities of what you're facing here as a challenge, and also what we've been doing in the line of work at a bank, where we have seen we've been wanting to become more design and user-centered for the last years. And for some time, the design community and our way of govern and way of working have been quite separate. So the design community have been trying to do their job, but in a siloed, like sandbox area. But for the last couple of years, we've been more and more intersecting the overarching way of working with a more user-centric and design-driven way of working. And for us, that had become a much better way with collaborating with different kind of people and different kind of competences that also have made the design perspective have become a bigger mandate, and therefore also supporting the organization to do better choices, and not just from an inside point of view. What I'm getting to is my question is that when it comes to policy design, and I'm really sorry if I don't understand so much about it yet, but is there a process for making policies that you can tap into? Is there some way that it's designed and done today, but where the design components are not put in yet, that you are now experimenting with?
I could maybe reflect a bit on that. I used to sit in one of these government committees myself before, and I'd say if you're in Swedish the term utredare, so if you're a kind of government investigator, which is a sort of a profession and a line of work, there are some sort of traditional ways of doing these kind of committees. This is on the national level, and when you appoint these government committees. So what we were trying to do is we're trying to sort of intervene in this quite traditional way of, looking at data, looking at statistics, doing maybe some interviews, having expert groups, which is kind of, the traditional methods of doing these kind of investigations. And then to intervene in that and then open that up to include much further perspectives in terms of doing actual interviews and workshop with users, interviewing nurses. So an example is that what would traditionally happen is that the head of the nurse association in Sweden, Vårdförbundet, will be on the expert committee, and she's meant to channel the perspective of nurses. But obviously that's quite different from interviewing a frontline nurse who's actually working in a hospital and using her experiences as a part of the policy making. So I would say that it's not always the same, but there's some sort of, methods and kind of things that you usually use when you do policy making on this national level. And we're trying to see if we can open that up to bring more perspective and more kind of lived real experiences in order for the policy that comes out in the end actually work when it comes down to, the hospital or the actual sort of frontline services. But I think it's very different, as David says. I think this kind of national policy making, one of those committees, is very different from the way it happens on a regional level, where it's obviously the politicians who sets the main framework, and then it's civil servants working on it, and then eventually it's like the kind of frontline staff. But that's quite a complicated and like messy process where it's quite difficult to say exactly where decisions are made, and it's not like a 5-step process that you can read about and then understand usually. I don't know if Kalle, if you want to comment on that.
You did it really good. I think see that Jonas has also posted some kind of PowerPoint of probably a policy cycle in the chat as well. Thank you for that one. If you want to come in and comment on that, Jonas, you're more than welcome. But I'll let Nana in before that, I think. So please, Nana, and also maybe an introduction if you want to say who you are and where you work, maybe.
Hello, thank you. Nanna Hoff. I'm an architect, KTH, but more interested in the society and between all the buildings. And at the moment, children, schools, and I have been working with the culture and in theater and such in 20 years before I became an architect. So I have like a very broad experience and listen and go to quite a lot of seminars. And I really don't think all these English terms help us, because as I see Sweden today, as differ from Sweden in the 80s or 90s, beginning of the 90s, it did work as a society. It did actually work before the school became regional or the communities thing to kind of sort out. And now if you talk, I mean, I see a lot of architects. It's not architects, it's just kind of digital architects. I don't know what the meaning is with using design if you actually try to get those together. The life of academia and the life of person on the kind of ground who works a lot and knows what's happened the last 20 years with this health and private sector. So I mean, I've been doing research as a set designer from beginning, and a big problem is, you talked about what is the problem. Well, are you talking about the problem or the symptoms? And a lot in the discussions are talking about the symptoms, but if you do the consequence analysis, you actually come to 1993 when this economical new public management came into all the society, all the official society. And that is the problem, I think, to where we are now, because each little part can't talk with the other part, or you have a budget on one part that you have to do a lot for another part in the community. So it's not different budgets is a problem, different language. I talked with the Vetenskap Allmänhet the other week, and they try to get kind of the academia to talk with civil society, which is a big problem today. They don't have any communication level. Thank you.
Thank you, Nana. And I see that we have no hands raised. Maybe someone want to yeah, you have Nicola with a physical hand
Yes,
raised. Please.
I cannot find the hand, how to raise the hand, because what just Nana said, and is also related to a slide that Jonas sent on about the policy labs as part of the policy cycle in the chat. Is a slide, and they mentioned the sandbox. I shortly mentioned it before, the concept of sandbox. I think it is very relevant, but in many cases we must be careful, because if we call it a regulatory sandbox, it means that we are using a sort of common and accepted definition of sandbox in the EU, that is experimenting how if we suspend some regulations and experiment beyond the limit of the law for a moment, then we can understand whether we should change the regulation or not. So this concept of sandbox is interesting, but is limiting, because what we need to do and it is very supportive to policy making, in my opinion, is a concept of sandbox that also implies social and technical aspects. So,
I was say,
so creating opportunities for people to talk within the sandbox, and to talk in plain language, not in academic or bureaucratic language, and make sure that the innovation or whatever is proposed, whatever is studied, the policy and so on, is discussed for its social aspects. For instance, how our practices, our social practices confronting in the sandbox, and of course the technical and technological aspects, because in many cases we give for granted that certain technology are well designed and they will work, and in fact they work as up to the moment in which the first user start using it, and they don't work anymore. So using a playground, if we don't want to call it sandbox, we can call it in a different way, but using a playground that gives opportunity for different competence, knowledge, practices to talk to each other in plain language.
Perfect, thank you. And now I think that since we have heard Lisa Malmberg's name a few times in this meeting already, and since Lisa is writing so much interesting in the chat, I'm inviting you, Lisa, into the meeting and have your reflection on what you have heard and what you also maybe been writing in the chat.
Oh, well, I haven't really been writing that much in the chat. I was just reflecting on I mean, I worked with a few different policy design projects, not as big as this one. And I would say that one of the challenges that we've seen in, I would say all of them, have been actually getting the relevant knowledge in the room, which I think, I mean, Matilda and Kajsa described very well how important that is, and how much that, like, that's really key to making this mayonnaise, or what you want to call it. And I saw that someone reflected, I think it was David maybe, that we need to be pedagogic about how to explain why we're doing this and what it is that we want. And I've seen that, yes, I agree with that's a really important part, but in my experience, that is not always enough. That even though we can explain that and we have that with us, and that the actors that we want to engage, they agree with us that this is an important and an interesting question, they do not have the ability to prioritize these questions at the moment, either because of resources or because of conflicts of interests with other prioritized questions that they need to focus on, and so on. So I think that's a really important thing to also reflect upon when working with this. How do we ensure that we actually get the relevant knowledge in the room, and how do we find ways in handling that when we might not. There's different ways of introducing knowledge into a room. All the people, as I understood, you with this puzzle, part of the knowledge was in the pieces of the puzzle, and that's one way to solve this. But I think it's an interesting thing to maybe reflect a little bit out as well. Because that is a really important challenge that we see in a lot of the policy innovation projects that we work on.
Thank you. And I'll let Sebastian in right directly here.
Yeah, thank you. Lisa, I think it was my comment when I was talking about pedagogy as like the fundamental part of letting people in. And
okay, thank you. Sorry.
No, it's fine. And also a great question, by the way. Then I understand what you mean by mobilizing. Actually mobilizing. We have the same issues in basically all projects that I'm involved in. And one thing that I've started to try doing actually, and it's a very uncomfortable. It's actually to put people against the wall and say, hey, what can you actually contribute with? And what is actually a wish list in this discussion from your part? And then you will just say goodbye. Now you heard my perspective, and I may leave now. And so if you actually do that, it might be a bit uncomfortable, but sometimes that actually works, because then people understand the weight of their input and their that they actually can be able to take action on that later. So it doesn't just leave at being something that people say, okay, that sounds great, let's do this, and then now who is going to actually implement this, and who is actually going to facilitate, but that you actually ask people before you involve, and like, can you actually contribute to this, do you think? And that's also a hard part, because then you also need to explain it in a very good way before you even start it. So that's a whole different issue, but that's something that we've been trying to do lately, and sometimes it works, sometimes it's only uncomfortable. But yeah, that was my input. Thank you.
Thank you. And then I think I'll let Jonas Gumbel in as maybe Lisa wants to respond on that one. Maybe if we have a.
Yeah, maybe because I see that it's also sometimes that we don't when working with policy, as Kajsa said in the beginning, we need to understand the system that we're working in, and that's what the PolSci part then contributes with. I think that was really, really nice. But then we also need to understand that sometimes now my English is really long time since I spoke English, I realize the actors with actual mandate to work with the results. I think I mean, that's part of those are the actors that I've found it quite difficult sometimes to engage. So I think Sebastian, your reflections really interesting, but I think this is also a little bit different than the kind of actors that I'm struggling with mobilizing sometimes. I think maybe Jonas have some thoughts related to this. Maybe, I don't know.
Yeah, I kind of have the same point, but I think it's easier for you with this example that you had. When it's a commission, it's a governmental commission. It's much easier to find people who actually put in some time because you have kind of a magnetic attraction when it's on the national level and it's the government assigned commission and so on. It's much harder if you under the agency level in the society and you try to engage agencies, that's hard enough. So if you're in a municipality or a region or in a company, I mean, it's much harder to engage the organizations and the people who actually have mandate to change what you wish to change is much harder. So, and I'm working at Vinnova, that's the Swedish Innovation Agency, and we try to promote this kind of methods and we try to finance this kind of projects sometimes. And I also think that we have a role to fill here as an agency, trying to connect the local and regional level to the national level, because I think it's easier for us to speak to another agency than it is for projects on the local and regional levels. And also, since we're working more and more with systems innovation and complex societal challenges, we need the national level and the state level, maybe much more now than when we worked with innovation that was more in silos. So many projects just go into a wall when you don't have the people with the mandate with them from the beginning. So they co-produce the solutions and they carry the solutions. So kind of the project that we wish for is when you have an agency or for that matter a committee or whatever that actually takes lead and connects with the local and regional level, but they kind of carry the project and carry the mandate and the voice towards the government or other agencies that need to change. So I think that's kind of the first question we ask when for example, we work with a lot of system demonstrator projects that try to have the kind of system approach to transformation. And that is when they kind of run into policy problems or they want to develop a new policy to kind of reach their mission. That's the first question. Okay, do you have the people that actually can do something about this with you? Or is that kind of the first step you need to investigate, how to engage them and so if not? So yeah, and I also I see that both Anna Edvall and Lisa is in the room. So I put the guide that we made together with Ramboll when you both worked at Ramboll on kind of policy design in the chat also, if you will. And that's the first iteration. It's a beta version, so if we can help each other to kind of improve that would be super. And I also put a link to an introduction to policy innovation with innovative methods in the chat also. And that's also the first step for us trying to get the message through that we need to kind of put in this kind of methods into policy development. And the first frame or the first slide I put in the chat was also because I think we all need to kind of be better at explaining for the policymakers how design and systems innovation can contribute to what they do. So we kind of solve a problem for them rather than put the new methods into the lab that they should also do. So kind of turn the argument to, okay, you have a large problem here. You need to solve a complex problem. Here we have a method that is fun, that you can use. It's kind of it's a process that you can keep to, and so on. So yeah, I think if we can help each other trying to get the pedagogics in place, so we can explain this for people who doesn't know why they should use this kind of method. That would be super.
Thank you, Jonas. And I think that we have one person from the Latvian innovation team in the Zoom room as well. Elma, I know that you have to run in just a few minutes, but maybe it would be interesting to hear your perspective from what you've heard from a Swedish perspective, when I know that you work with almost the same things, but from a Latvian perspective. So please, if you have a couple of minutes.
Yeah, thanks, Kalle, for giving a word. And also, what a great opportunity to hear that we are all struggling with the same issues and we have the same questions in our minds and the same we are having with my colleagues at Innovation Lab in Latvian State Chancellery. State Chancellery basically is a government office, so we are sitting at the headquarters and working alongside with our colleagues and Prime Minister and State Chancellors. Which is a great privilege, at the same time really hard work. And every single day we are trying to do whatever we can, and we are using design sprints as one of our key methods how we do that. So basically, ministries are coming to us with their issues, and they are usually not framed at all. They don't know what to do with the problem, but the problem is in the room. So we are trying to help them to work with this elephant and to look at it. And we are really emphasizing that we are not an external solution, so we don't have the answers on their questions. So we are going to sit at the table all together and trying to find the best way where to start, where to bite in, and how to co-create. So this co-creation and exchange of different experiences and knowledges is one of the really crucial points. And as you also all mentioned, it's not an easy work, but I think what drives us and what drives the people who are coming is the meaningful and also the urge or the understanding that this is a problem. And if we don't do anything about it, it's going to become only bigger and bigger and impossible. So we're dealing with these systemic issues. And for now, we are really project-based ones. We're not in the state budget, so we're like this fiscal neutral imprint. So almost all the time we need to justify why we are doing what we are doing, why we are using those design methods. And it's a really hard question to answer because, as also here was mentioned, there are different methods and different ways how to get to the result, and you never know which is the right. So all you can do is just to try, trust your guts, fail a lot, and then again try again and find the basis where to go. Yeah, a short and brief. Unfortunately, I really need to run to another meeting with my colleagues, but thanks a lot, and guys, you're doing a really amazing job. So
thank you very much, Elma.
Keep going.
Thank you very much. And the time is almost up. I see we have one raised hand, so I'll let the last word to you, Nana. So please.
Yes. I have been working with creative processes since I was 16 years or something, and I've been writing the architect process and for being creative, being in the creative kind of bubble. So people who are overloaded with a lot of work every day can actually go out of that and be there and think without all the mess that is for now at the moment in the healthcare and have been for a long time. So I was at Mistra's whole day seminar yesterday, no, the day before, and it was Tim Jackson had a really good some PowerPoint pictures, and that was the care economy. So instead of BNP, it was the care economy, because BNP doesn't help us any longer. And my view of the healthcare is that, and his pictures showed all this very dangerous food with all the is. It's not food, it's something else. And the price for that, and then the symptoms and all the pills and the price for that. And it's exactly the same. So that's a big question, I think, in the healthcare. And it would be good to address that more.
Thank you. And I think we will have to do that another time because time is up. It's 3 o'clock. Thank you very much for attending this Experio Reflections. And thank you very much, Nicola, for being our critical friend on this session. And thank you very much, Kaisa and Matilda, for the great presentation. But most thank you to all of you that have been listening and to be reflecting together with us and help us to learn together. So hopefully we'll do another reflection in a couple of months' time. And I also want to say that you all are invited to write these reflections with us or for Experio Lab, because we see this Experio reflection not just something that we at Experio Lab ourselves are doing or writing, but it's a kind of an arena where you can have your own reflections and we can publish them, or we can have these kind of conversations together about your work and all the great things you're doing as well. So if you want to contribute to this reflection series, please reach out to anyone in Experio Lab. And with that, I wish you all a great weekend, and I hope to see you all very soon again. So thank you.
Thank you.
Thank you. Bye-bye.
Bye.